Welcome to Cancer Explained with Central Care Cancer Center. It's likely that someone you know has been diagnosed with a form of cancer. Learn more about specific cancers, their risks, signs, symptoms, and treatment options by listening to Cancer Explained.
Hello and welcome to Cancer Explained with Central Care Cancer Center. My name is Leanne Powers. I'm the Marketing Director for Central Care Cancer Center. And with me today is Radiation Oncologist Dr. Perez-Tamayo. At Central Care Cancer Center, we are dedicated to keeping expert cancer care close to home. We have state-of-the-art facilities throughout rural Kansas and in Missouri. Whether you need radiation or chemotherapy, access to clinical trials and novel treatments, financial counseling, or other supportive services for yourself or your family, Central Care Cancer Center is here for you. At any time, feel free to email with any questions or comments to askdoctor@cccancer.com. That's ask, DOCTOR, at cccancer.com. January is Cervical Cancer Awareness Month. So today, our discussion on Cancer Explained centers around cervical cancer. Good morning, Dr. Perez-Tamayo.
Good morning, Leanne. Thank you for having me.
First, let's talk about a pelvic exam and what does that entail?
Well, it all starts there with cervical cancer. However, one of the things that people need to be aware of, especially in this day of COVID, is that this is one of those areas that you may not be familiar with the terminology or things that should go wrong that may not be obvious to you, because women have periods, they bleed, we have bleeding for other reasons. There may be blood due to a urinary tract infection. Menopause can be in and out. And since this is a cancer that is mostly in women, young women that may still have their periods, or women that are actually going through menopause, the actual experience of having something abnormal is not necessarily going to be obvious. So a pelvic exam is very important as a routine for women that are sexually active, actually all women, but in cancer of the cervix, it is usually an HPV positive type of cancer, not all of them, about 80%. So it is something that can be detected early with Pap smears, which is part of the pelvic exam. So as part of your pelvic exam, your primary care physician, your gynecologist, will routinely do this, once a year. If you're at high risk, maybe twice a year. A Pap smear has different recommendations depending on your age, and the American College Cancer Society there's a American College of Family Practice. There's other recommendations, but usually the cervical cancer screening starts at age 21. Yet in my advice is, if you are sexually active, independently of your age, that's when you need to have a pelvic exam for many reasons, not only cervical cancer. And a Pap smear between the ages of 21 and 29 should be at least every 3 years. If you have changes in your Pap smear, it may require even yearly Pap smears. And those changes may not be very obvious. There's something called coilocytosis, or like a coil, which means that there are some abnormalities in your cells which are already showing changes that are concerning, or what we call dysplasia, or in other words, this is meaning that the plasia is the growth. The growth is becoming odd. It's not becoming orderly. There is something wrong, something irritating the cells, and you may need to have other type of screening during your Pap smear. Then at the age 30, the Pap smear may be in combination with the human papillomavirus test, because as you probably have heard throughout the HPV revolution, let's put it this way, that not all HPV causes cancer. Some of them are almost certainly going to cause you cancer, and some of them are not. And therefore, here again, we're going to talk about the vaccination later on. But this pelvic exam and Pap smear needs to continue until about age 60, 65. Now, what does it entail? A Pap smear entails basically smearing the surface of your cervix on a slide. Now let's talk about anatomy. The cervix is the entrance to the womb. It is completely different than the womb itself. It has a different covering. Inside the womb has cells that produce your period. The cervix does not. The cervix is more of more like your skin. And so when you have a pap smear, you do not get really samples of your womb. It's only of the cervix. So it does not detect cancers of the womb. In other words, adenocarcinomas, endometrial carcinomas. It only detects cancers of the cervix. I have many people saying, but doctor, I just had a pelvic exam and a pap smear and they were normal and I have ovarian cancer. Well, a pap smear rarely would detect something other than your cervical condition. Now, when you have a pelvic exam, you need to make sure that your doctor does a complete exam, which means that you have not only the external exam of your external genitalia, because there's other cancers or other conditions of your labia, clitoris, or other parts in the external portion that would need attention. And those include molds that are changing. In fact, one of the highest incidence of melanomas are from that area. So again, sometimes because we have pubic hair, it may not be something that you can easily detect, or maybe your partner can detect, but maybe your family practice or gynecologist can detect that there's an abnormality in your skin. Then it requires the examination of your vagina. The vagina ends in this little cervix, which looks like a donut. And then the donut is actually if you can imagine, a flask upside down. The opening is the bottom and the bulbous part of the flask is inside you. The womb is inside. Then in the womb is connected these two tubes, which are the tubes that lead to your ovaries. Now, for you to be able to do a complete exam, you not only need to look, of course, like I said, the external genitalia, the vagina, the speculum exam, but also you need to do a bimanual exam, and meaning that you put your examining hand, first in the vagina to feel your uterus and your cervix, and then you have to do a rectal exam that will be able to detect your ovaries and tubes and other parts, which are called perimetria. So if you don't have that part of the rectal in your pelvic exam, your ovaries are not palpable. Please, if you get anything out of this talk, you need to ask for a rectal exam during your pelvic exam, because otherwise you will never be able to know if your ovaries are normal, your tubes, or something called perimetria. Perimetria is what holds your uterus into a position in your pelvis by these fibrous bands that are attached to different parts of your pelvis, but mostly the bone. So if you do not have a bimanual exam, meaning vagina and rectum, you are basically missing half of the organs that need to be tested. So if you do not have that exam, and you know ovarian cancer, which we will talk on some other day, is pretty silent. So if you do not have the exam, you basically don't know what has happened.
Is there some sort of symptom for cervical cancer that is prominent to be in order to detect whether or not this is something that you might have?
Well, unfortunately, once you have the symptoms, you usually are a little higher up in the staging or another more involvement. Usually, the symptoms of cancer of the cervix are not detectable when it's early, meaning your pap smear and your exam are going to detect it when things can be very, very early, when a simple surgical procedure can take care of it, or even a cone, what they call a cone. However, when you have symptoms, for instance, spotting between your periods, does it mean that you have cancer of the cervix? No, you can have spotting between your periods for no reason. But if you have them, you need to investigate that they're nothing to worry about. Something called dyspareunia, which means pain with intercourse, is a very common symptom. Now, many women have some pain on intercourse because of different reasons, but when it becomes something very significant and constant, you need to report this to your doctor, because that is abnormal. Another symptom that is common is that you have bleeding that doesn't stop. You have a period that goes on and on and on and on. And many times the symptoms are actually that you have been losing blood, very little, maybe not detectable, but you become anemic. And so all of a sudden you're tired, you just don't have the oomph because your red blood cells have been shedding through your cervix at a very low rate, and you may not even know that this happens. Now, when you have symptoms that are very astounding, like for instance, in your urine you have blood, or in your rectum you have blood, it could be that this cancer in the cervix has invaded those organs.
So you had said earlier, too, that this could be younger women primarily might be affected with cervical cancer. So is there like an average age or anything? Or
the average age is really in the 20s and 30s, but the reality is that I have seen them even in the teens. With this human papillomavirus, some of it can produce you cancer very, very early in the exposure. And that doesn't make you incurable. It just means that it can grow quickly. So you have to be wanting to take care of it so you don't have repercussions that are non-reversible. Like, for instance, the cervix, as I said before, is sandwiched between your bladder and your rectum. So if things start growing, even just slightly, they can invade these organs. And then we have to have a whole lot more treatment and even loss of organs surrounding the cervix, because one just didn't want to perhaps recognize that these symptoms were abnormal.
Once again, being your own advocate, getting that yearly, pelvic exam, the pap smear, it all is so important in order to catch anything that might actually come up. Again, I'm with radiation oncologist and president of Central Care Cancer Center, Dr. Perez-Tamayo. So should we dive into HPV? What exactly is it?
HPV stands for human papillomavirus. Human papillomavirus, there's many human papillomavirus, but about 4 to 6 of them constitute about 80% of the cancers in the cervix or vulva, or really any place where there is a mucosa. When people call about, say, mucosa, it means the covering of organs. Like, for instance, your mouth inside has the covering of a mucosa. And if you look at your cheek, it has skin. While inside, it's moist and glistening, but it's also a covering called mucosa. The cervix, the vagina, is very similar to that situation. You have your genitalia, your labia that are covered with skin, but right near it, right at the border, there is actually a border between the skin and the mucosa. And it is these places where there is transition between skin and mucosa in your cervix. It's the cervix and the inside of your womb or the endometrium where they are at most risk for having problems. The human papillomavirus is a virus that basically injects itself into the basement membrane of your mucosa. And then it is a receptor, a form of a catcher, catches this this virus, and the virus then gets to cause havoc in your cells. They start stimulating them to grow abnormally, like you would think of a wart. In fact, some human papillomaviruses just cause warts, and they are malignant warts, which would be a cancer of the cervix. And why is it malignant? It's because it doesn't stop. It becomes to grow it looks like a wart, but it starts to invade tissues around it. It's able to grow and start eating the tissues of your cervix, of your vagina, of your womb, and then it goes outside into the organs around the womb and the cervix, which is up in basically, if you can imagine, the roof of your cervix is the bladder, and below the cervix is the rectum. So then it starts invading those two organs. In fact, part of the workup, if we feel that it is necessary, is to look in both organs, because if you have involvement of either the bladder or the rectum, you're still curable, but we have to be a little more comprehensive in the treatment and hopefully not have you lose those two organs.
So you don't necessarily have to have sex in order for this virus to spread, correct?
No, on the contrary. It is only through sexual intercourse that you have this virus. It is not picked up through a pool or a seat, like a toilet seat, but it is through in fact, these human papillomavirus can grow in other mucosas, let's say of your mouth, and if they have to be introduced by something. Now, I have a theory, and this is just a theory, that there is more than just maybe sexual contact that can introduce something like your hand or somebody else's hand. But because we do see these cancers in other places when they travel through different media. So there may be some more to be studied there, but there is no doubt that in the case of the cervix, it is a sexually transmitted cancer.
So is there any symptoms to having the HPV virus? You said warts. I mean, I assume...
No, not all of them cause warts. In fact, we have many human papillomaviruses in our bodies that don't cause anything, but some of them will cause warts. In fact, there's something called butcher's warts, which are caused by meat, actually, in the hands of the butcher. And you have it in your hands, and they do not cause cancer. So you have these viruses, and most viruses cause something, and warts in this type of cancer can be just the only thing. There's something called condyloma. Condylomas are warts, or genital warts that can grow big. They can be unwieldy and not very, they're unsightly, and they can bleed, but they're not cancerous. They can be removed, and then that's that. But as you know, you can imagine that it's called a field effect. In other words, usually the virus didn't just affect one spot. Wherever the exposure was, it could be the entire region that is at risk.
You're also looking, since it is kind of sexually active, I mean, let's just say who knows who your partners had sex with, and then their partners had sex with. I mean, you're going back to how far back exactly in order for that HPV virus to spread.
Well, that's right. And Leanne, this is the, we always want to point a finger at something that is, unless both the partners were virgins when they got married or when they became together in a sexual way, then there is something that can be pointed to. Whoever broke that vow is going to be bringing to the partnership the human papillomavirus. If you have two virgins together forever, there is no human papillomavirus. You need to understand that almost all women and all men that are sexually active will have human papillomavirus of some sort. That
is very striking to know, honestly. Because you just said that. I mean, I've got a stat here from the CDC about like 80% of people will get the HPV infection in their lifetime,
or more.
Yeah. I agree, yeah.
But that doesn't mean that they're going to have cancer.
Right.
So it's like if I said to you, you gave me staph of my skin. Well, no, everybody has staph in their skin. So it's what we live with, viruses, and we live with bacteria.
I'm Leanne Powers with Dr. Perez-Tamayo from Central Care Cancer Center. We've been covering cervical cancer today, but Dr. Perez-Tamayo, let's now talk about HPV vaccinations. Preventive measures to HPV, of course, get the vaccination, correct?
That's right, and they've changed the requirements, and when it first came out, only women were able to get the cancer. They get the HPV vaccination. And now both males and females early and hopefully before they have been exposed to the human papillomavirus, meaning before they're sexually active. But 4 of the HPV variants are the ones that cause about 80% of the cancer. So if you are able to get your vaccination, you are going to eradicate 80% of your chance. And not only of your chance, but as a man, you, of course, don't want to feel responsible for you to get actually cancer, because you can get penile cancers and other cancers. And also that you may lose your spouse, the mother of your children, through something that could have been preventable. So, and they're going, the human papillomavirus vaccination is now even available to people that are in their 30s and 40s.
Okay. So it doesn't have to be, I know that there was a push, like a revolution that you said earlier, for teenagers, and like as young as I think 11 and 12 actually to get it, but now you can even get it into their late 30s, correct?
That's right. And most children are offered this vaccination with their pediatric regular shots, but there's also fairs, and it's free. There's no reason why to avoid it. It is not giving anybody permission to be promiscuous. It's actually avoiding, like you would want to avoid polio. Why would you want to have any kind of infection that is preventable that gives you quite a lot of trouble for something easy as a vaccination?
Mm-hmm. So Gardasil 9, I think, is the most common vaccination.
It's the most current.
Okay.
And the Gardasil is usually not a one-time shot. Usually it's and I'm not familiar with the very latest, but usually it's 2 to 3 shots. And just like any vaccination, it's the local area is what hurts you, where they give you the shot, but afterwards you're done.
So does this mean that women who get the vaccination still need to go ahead and get their pap test and their pelvic exam and everything like that?
Yes, because it's not 100%.
Yeah.
It's only 80%. And so you have a 20% risk of having cervical cancer. But, the pap smear does test for cervix, but your pelvic exam tests for the other parts of the women's anatomy, which is not covered by the vaccination.
Right. So the vaccination only covers basically an HPV
infection, but it can be of the cervix, vagina, vulva. In fact, most vulvar cancers are also HPV.
So in conclusion, it's in order to prevent cervical precancers, it's important to have screening tests, specifically the pap test and HPV test as well, which is that a blood test? Is that right? HPV test?
No. Actually, they will run the smear, and you will be able from the pap.
Okay.
Yeah.
And if it's a precancer is found, then of course, that's when they treat it and hopefully prevent it from turning into cervical cancer. I also wanted to talk a little bit about Early Detection Works program here in Kansas, because I think that that's important for those women who may not have insurance or feel like that, or haven't had maybe a pap test or even a mammogram for that matter.
Well, yes, it is a wonderful program, the Early Detection Works program. It works for both breast cancer and cervical cancers. There's a few caveats which are important for you to know, especially for the breast cancer, because you cannot have a biopsy if they're going to cover your workup. So if you had a biopsy, pretty much you become, not a candidate for this works program. However, in the cervical screening program, it covers 21 to 64 years of age, and for the cervical cancer, and it is primarily for people that do not have insurance. They meet income eligibility guidelines based on the guidelines of 250% of current federal poverty guidelines. It is free and really very private. So I don't know if most places have the ability to connect you with this program, but we do. We have our financial counselors in every center that we have, and they'll be able to connect you with this program, which will be not only life, prevention of loss of life, but also it will also not burden you with financial problems.
That's right. And it's so important. I mean, especially if you have never had a pelvic exam or, to get tested here for the cervical cancer or even a mammogram. So there is a toll-free number to call, and I will give that number out too, just in case you had any information. But you can also always call our clinic at 342-1117 in Emporia. But the toll-free number for the Early Detection Works program is 1-877-277-1368. And then you can ask about how to get yourself enrolled or to see that if you qualify for the free exam. Again, 1-877-277-1368. Okay, doctor, let's talk about treatments and stages now.
Most cancers, as I said, of the cervix are squamous cell. If you have another type of cancer, it may be treated of the cervix or of the endometrium, may be treated a different way. But for stage 1 cancers, the survival is almost as 100% as you can get. 92% survival is what is quoted. And more, it's not 100% because even though we have all kinds of technology to say that you're stage 1 comes in a spectrum. There's stage 1 where it's minimally amount of cancer to a large cancer that is called a barrel-shaped cervix, which means a lot of bulk. So that's where the variety gives you that 92 percentile. But when you have premalignant conditions that are going to be treated with either ablation of some sort, ablation means that they're going to kill the offending HPV, let's say, or the offending dysplasia with various methods, including a cone or even up to a hysterectomy, simple hysterectomy. Those cancers are almost always cured. Now, the problem begins if you are interested in having children and that sort of thing, because if you are going to have children and part of your cervix is removed, even if it's a small amount, then your chances of having miscarriages are very high. So it isn't something that is done lightly. It's something that has to be done in a timeline. What are your intentions as to your ability to have children? And then also, if this is more involved, does it require something where they're going to remove your ovaries in addition? Or we're going to treat you in a way that would make you unable to have children later on. Many, many women are actually diagnosed at the time that they are pregnant, because that's the time that they go to an obstetrician. And what happens is that it may be the first time they've ever seen a gynecologist. So then is when we begin to see, okay, we have this issue. You can carry your child to, let's say, term, but then after that, we have to make decisions about your cervix. So again, we don't want to get to that point. We want to take care of things when it's easy to take care of. When you have a stage 1 cancer, you can treat it in various ways. Sometimes just removal of your uterus is all you need. Sometimes even stage 1s require treatment with radiation and chemotherapy. Most cancers now, whether they are a later stage 1, 2, or 3, are treated with a combined radiation and chemotherapy with great success. So, you want to do this when you still have the ability to maintain your organs, and I'm talking about the bladder and the rectum. If you should fail, then unfortunately the only available mode of treatment is to do something called an exenteration. Exenteration means that you get removal of your uterus and cervix, but also of your bladder and your rectum completely. So you're left basically with 2 colostomies, one colostomy for your colon and an ileostomy for your urine. So why go there when they are so highly, highly curable? So before you get into, whether it's something that you should do or not, take care of it when it's easy. And in addition, when you lose something, it's gone forever. So it's not something you can go back. These cancers also bleed very easily. It can be like an open faucet. So when you have loss of blood, and you have children, because you can be in your 30s when you have this, and let's say you have a couple of kids, and you just don't have the energy to do all you need to do as a mother, or if you work. So you don't want to get there either. If you should get to know your body. If you feel that you're tired, out of proportion, something isn't right.
It amazes me to know, it sounds so simple. Cervical cancer could be so severe from what you just said. Where you could lose and have colostomy bags, and
you don't die. That's the problem. There are cancers where you can live with a cancer of this type, invading all your organs in your pelvis, and you don't die. So you have all of these losses for nothing. So I have had many people that want to ignore this, thinking, well, maybe they'll die, quickly, and that does not happen. When it's something very simple to take care of in the stage 1, even up to 3, I have almost every patient that I have treated survives. Why would you want to get to a point where you don't survive and you do lose function and quality of life? So important, doctor. I can't thank you enough. Is there anything else that you'd like to add? Well, yes, I want to please, stress to people that as we go into the higher stages, the more cancer you have, the more rigmarole there is for you. So usually we're looking at chemotherapy. We're looking at radiation, both external and internal. And it's not a smorgasbord. My dears, please listen to me. It's not like you can have no broccoli and add me more cauliflower. It is not something you can choose. It's not have it your way. The rules are pretty strict. You have to do it in a certain way and in a certain sequence. And it is for instance, chemotherapy is by meter squared. What does that mean? It means that your height and your weight dictate the chemotherapy. The chemotherapy is the same here in Algoma, Wisconsin, or in Los Alamos, California, the same. So why would you want to travel when you don't have to? The radiation, likewise, is very strict. You give this much, and then you go to the brachytherapy, or the you do the external radiation, and then you do the brachytherapy, which is the short distant treatment, and it is the same thing. It's always the same. So you don't have to be going to all kinds of ends of the world to have something at home, at the comfort of your home, where you work, where your children are. I would urge you to come in and get checked. And if there's something to be done, let's just do it.
That's why we're here. That's right. Thank you, Dr. Perez-Tamayo. Well, we appreciate you taking the time to listen to Cancer Explained with Central Care Cancer Center. With facilities throughout rural Kansas and in Missouri, Central Care Cancer Center offers complete cancer care all under one roof, so you don't have to travel far for the best in care. Whether you need radiation or chemotherapy, access to clinical trials and novel treatments, financial counseling, or other supportive services for yourself or maybe your family, Central Care Cancer Center is here for you. You have a choice. Bringing expert care to you is an important component in the success of your outcome. Being surrounded by your family and friends, that can be the factor that elevates your treatment. Feel free to reach out to our offices by calling 800-592-5110, or you can visit us online, cccancer.com. You can always send an email as well to askdoctor@cccancer.com. For Dr. Perez-Tamayo and all of our amazing providers and nurses, I'm Leanne Powers. Thank you for listening to Cancer Explained with Central Care Cancer Center.
You've been listening to Cancer Explained with Central Care Cancer Center, offering expert cancer care that's close to home. Central Care Cancer Center has clinics throughout Kansas and in Missouri. Central Care Cancer Center, online, cccancer.com.